Knee replacement relieves pain and reinstates the normal functions of your knees. Surgeons remove damaged bone and cartilage from the thighbone, shinbone, and kneecap and replace them with an artificial joint crafted from metal, high-grade plastics, and polymers. Surgeons examine your knee's motion, stability, and strength and use X-rays to evaluate the extent of the damage. Surgeons consider a range of prostheses and surgical techniques depending on your age, weight, lifestyle, knee size and shape, and overall health. Most patients undergoing knee replacements experience pain and mobility issues caused by osteoarthritis, a condition characterized by joint pain and stiffness. Follow any prescribed exercises from your doctor to strengthen your knee muscles before and after surgery for a quick recovery. Maintain a nutritious diet rich in vitamins and minerals to support your body's healing process. Maintain a healthy weight to reduce strain on your knee joint. If possible, set up your living space on a single floor to avoid climbing stairs. It can be challenging post-surgery. Your surgeon keeps your knee bent to expose all joint surfaces. An incision about 15 to 25 centimeters, 6 to 10 inches, is enough to move aside your kneecap and cut away the damaged joint surfaces. Then, they attach the prosthesis piece by piece. Before closing the incision, they bend and rotate your knee to test its function. Knee replacement surgery lasts about 2 hours. You will spend 1-2 hours in a recovery room after surgery. Patients go back to the hotel after staying at the hospital 1 or 2 days. Moving your foot and ankle increases blood flow and prevents swelling and blood clots. Your team will ask you to do frequent breathing exercises. A physical therapist will teach you how to exercise your new knee. After leaving the hospital, you will resume physical therapy at home. After 3 to 6 weeks, you can resume most of your daily activities. After recovery, you can engage in light activities such as walking, swimming, or biking. Total knee replacement surgery offers substantial relief, significantly reducing or eliminating knee discomfort. Following a knee replacement, patients experience enhanced joint mobility, facilitating easier walking, stair climbing, and engagement in previously restricted activities like hiking or cycling. Regaining mobility post-surgery plays a pivotal role in reclaiming personal independence. By undergoing knee replacement surgery and subsequent physical therapy, patients enhance strength, stability, and weight management. Hence, they can return to their favorite activities.
Care beyond borders.